Welcome to Hats Off to Aging. I'm your host, Ian Parkinson, and I have with me today Larry Mathieson, the Chief Executive Officer of Unison at the Veiner Centre. Welcome, Larry.
Thanks for having me again.
So the sun is shining a little hotter and longer. Apparently the tulips are slowly sticking their head out of the snow.
Yes.
So what's new at the Veiner Centre?
Well, I mean, we love this time of year because it's much nicer to walk down the side of the river at this time of year. But we do have some exciting developments. I mean, March is our big month to support Meals on Wheels, and so we have March for meals.
Okay.
And we actually started a new program this year, and it's a partnership with the city. And so we proposed, like the technical term for the program is what we would call a social prescribing program. Oh. And so the program is actually funded for 3 years by the Alberta government, and it will be a program where we will employ link workers whose office may be at the Veiner Centre, but their job is really in the community.
Okay.
And so these workers will actually have older adults referred to them or identified to them by the primary care network.
Okay.
And so they will go and work with older adults in their homes to reduce barriers for them to be able to kind of stay where they are, so age in place. And so whether that's at a senior's, like a lodge or a residence, or their own home. And so some of those, activities, they may help with them. They may actually make a referral to something like Veiner Vintage Transport or other services provided by different agencies. And so this is actually very complementary to the transportation program, but it's one of our efforts to kind of move out of the centers itself and support older adults throughout the community.
More space for pickleball and cornhole.
That's right. That's right. That's right. You got to have that your pickleball and cornhole for sure.
Well, age in place is a term I have heard of before, and it actually does make sense because if my memory serves me correctly, it's less expensive to keep a senior in their home than it is to house them in a facility or a hospital.
For sure it is. And that is one of the objectives. I mean, most older adults we talk to would say, depending on the research, it's 92% or 98%. Most people want to live at their home as long as they can. People don't say, oh gee, I really want to move into long-term care or something. That's not a desire. But it's also much more beneficial to taxpayers and the health system as well. If, the simple things that we might do, and maybe non-medical things we can do. Any nurses who work in hospitals or physicians would tell you, unfortunately, there's times where somebody needs to move into a medical or long-term care for reasons that are not necessarily primarily medical. And so we essentially were working with the primary care network to help identify those individuals that, okay, we could put these social or community supports in place, and that would reduce the likelihood somebody has to kind of go farther down that continuum until to more restrictive care.
Well, it makes sense to me too, because if your program identifies a socially isolated senior, and if they can somehow get them involved socially somehow using imagination, then their mental health improves as well as their physical health, which again reduces the stress on the acute care system.
For sure, and again, it's to the user or to the person who's receiving the service, it's much more pleasant and desirable than the alternatives, I suppose.
Well, and especially when you're surrounded by familiar memories and artifacts in a home you've been in for however many decades, plus the neighborhood. So if somebody has a vulnerable senior, for a better word, and they think this might be a program that could help them, how do they get a hold of you?
There's two ways. They can call the Veiner Centre directly, and our team can connect to a link worker. Or if they're working with community health or the PCN in any capacity, those professionals or those nurses might make referrals directly to us as well.
So you're going to go around handing pamphlets out?
I don't think we're going to have to market this program too much.
I don't think so either.
We were just recruiting the staff and starting to do the training, and already we'd started to get self-referrals. So it was very quick. But yeah, it's kind of an interesting intervention for us, because, as you said, programs like the transportation program tend to support other things we're doing, and now this program with the link workers will actually enhance those programs as well.
So it gets them out of the building, gives them some fresh air, and supports the community at the same time.
Exactly, yeah.
Anything else?
Well, March for Meals is our big thing this month, and we talked last month about the supports that we provide older adults through that program. But actually, kind of the fun part of Meals on Wheels is we will be having a number of local celebrities deliver meals this month. In all of March, the Keg and Medicine Hat Brew Co. will actually donate $1 from every margarita and mojito to the Meals on Wheels program. So people can support us. They can donate directly to our website, or they can go have a drink at either of those organizations and support Meals on Wheels.
Very generous of them.
Yeah, we're excited.
So how is the Meals on Wheels program funded? Is it all donations?
It's a big combination, actually. So it's partly supported by the city.
Okay.
A good deal of the labor is actually provided by volunteers, and so there's a lot of kind of recruiting and training volunteers, but we have a lot of long-term volunteers who've been doing this for some time, so that's great. We have people donate. March is our big fundraising month for this activity, but also part of the program is essentially a low-cost meal. So users pay a portion, and then if people meet certain income criterion, they also get subsidized meals. So it's a big combination.
The Veiner Centre is heavily involved in food, because you're not only doing the Meals on Wheels, you have a cafe / restaurant, and I believe you also provide, for a better word, cooking classes for newly widows and widowers.
It's if you become a widow or a widower, your day-to-day changes quite a bit, and we know that there's a lot of research around seniors nutrition and how that's important, and it's important for the health system, and you name it. But it's a time where people may need a little bit of support and encouragement to keep that going. And I mean, we know we're social animals, so we love to get together around a meal. So it is a tremendous platform for kind of building community, for sure.
Yeah, I mean, I've seen the signs on their vehicles. So it's good. Anything else for March and April?
Well, again, we're excited for people to help us out with our Meals on Wheels efforts, and whether that's volunteering or going to the brew house or the Keg and having a drink to support older adults. But yeah, for sure. And again, you can check that out, and there's a description of our new social prescribing program on our website. So if you want to hear more about what that's doing, or how it might support a family member or a loved one, for sure.
And out-of-town bus trips?
Out-of-town bus trips. The trips are going well, and like I said last month, we're expanding our offerings, and And we're very thankful for our volunteer committee because they've been a lot of the steam in the development of this program, for sure.
It takes a lot of energy to take 52 seniors to Moose Jaw.
It does. And I did not realize what a popular trip that was going to be, but that sold out very quickly. So
I was happily surprised to hear you sold it out so quickly.
Yeah.
Obviously, there's a need there. And again, you know, it's the food and the social activity and everything else.
Yeah.
Oh, well.
In both cities, it's kind of one of my favorite things. You go into the bistro or the cafe, and people are kind of sitting around waiting to load on the bus, and it's like Christmas morning with your kids. Like there's just a palpable excitement there. And it's kind of one of the most fun things we do, I think. So
good.
So
excellent. Thank you for coming in, Larry. Good luck. I wish you well.
Appreciate it.
And we'll see you again in the near future.
Okay, we'll see you soon.
Thank you for watching Hats Off to Aging.